Yeah, okay, let's get started. Thanks, Ryan, for your hosting, and Cheryl, and thanks everyone for signing in and participating in the session. It's really encouraging in these little warm-up moments before the session starts to see people signing in, where you're signing in from, and to see that you're signing in from all across the province in lots of different parts of Alberta. And I also really appreciate some of you putting in your kind of early reflections or why you decided to come out to participate in this session. It's really helpful to get a sense of who's joining tonight, so thank you. My name's Chad Park. I'm going to be the host for the next 2 hours for this session. For those of you who have attended any of our earlier sessions, you'll see that it's a familiar role for me. If you haven't, that's this is we're pleased to welcome you to this first session, your first session. For us, for the next 30 and the possibility panel, this is the fourth session, and fourth different topic. We've also had sessions earlier on economic diversification, on building an inclusive social fabric, on energy and climate a couple of weeks ago, and now health and wellness. And what you'll find, and I think those of you who've been at earlier sessions will probably support this, is that it's meant to be a really interactive session. So we will hear some people speaking, sharing their ideas, some of the members of the possibility panel, but we'll also really encourage you to share your ideas. The main point of this is for us all to share our thoughts and ideas on this topic. So encourage you, and in just a moment I'll give you a little bit of a tour of how you can do that. Obviously, the first way to do that is through the chat box, as you're already using. So thank you for that. Steph, we can go to the next session. Yeah, next slide. Thanks. The flow for the time we'll spend here together looks like this. And again, for those who've been to earlier sessions, you'll see that it's similar. We'll have some welcome remarks and framing, framing of why we're talking about this issue, and then we'll invite 4 members of the possibility panel to share 5 minutes each with their early reflections on what is possible on this topic. And that is really meant to just kind of set the stage for all of us to get the conversation started. And the way that we'll move on from there after a Q&A with those panelists for a few minutes is we'll move into breakout groups. And I feel I must say this at the start is a real encouragement for you to participate in the breakout groups, because the feedback we've received from earlier sessions is that for most people it's been their favorite part of the session. So sometimes it can be a bit daunting for some people, but to get into a small group with 4 or 5 people who you don't know, but that's been part of the magic so far at the earlier sessions. So really encourage you for that. And we come back together and we harvest the ideas that have been in those discussion groups and and your own ideas, and then have some closing reflections from some other members of the possibility panel. So that's the way it unfolds, and lots of opportunity in there for you to share your own thoughts and questions. Next slide, please, Steph. I think as we, oh yeah, the first thing I have to do is just make sure you've got all the tools and technology sorted. I think for the most part at this point, people are probably familiar with Zoom, and I see that a lot of you have been using the chat box already, but just in case you're not, the audio mute on and off is down on the bottom left, and same for your video. We do encourage you to have your video on so we can all see each other. It makes for a more personable interaction, I think. And then the chat box is where you can, as many of you are doing, insert your comments and questions and so on. You'll also notice that there's a live transcript that's coming across the bottom of the screen, closed captioning. So if you find that a little bit annoying, you want to turn it off, you just go to click live transcript, the button that says that at the bottom, and then you can click on hide subtitle, and that'll turn that off. The first thing I want to do is to do a land acknowledgements. And I know we're all coming from different parts of Alberta or beyond here. For me, I'm signing on from Edmonton, and that's Treaty 6 territory, which of course is a traditional meeting grounds and a gathering place and a traveling route for the Cree, the Saulteaux, the Blackfoot, the Métis, the Dene, and the Nakota Sioux. I'm unmuted now, am I? Okay, sorry. For some reason I went on mute there for a moment. But we do these land acknowledgements because it's important for us to understand and acknowledge the history of this place, and that includes the Indigenous history that goes far beyond what we know currently as Alberta. And I know, I mentioned this at the last session, that having done some coursework on truth and reconciliation through the Banff Center, a couple of the things that I learned through that, I just want to share here. One of which is the importance of the truth part of truth and reconciliation. And I mentioned before that sometimes it can be tempting or easy to kind of try to fast forward to the conversation around reconciliation. And I learned in that session the importance of really digging in and understanding our shared history, the history of the place before colonization, and understanding the harms that have been done to Indigenous peoples through the time. So that's one thing, is to dedicate ourselves to understanding the truth. And the second thing I learned, major thing I learned, is how important the land is and the relationship to the land is in Indigenous culture. And I think that's something that we can all learn from, and that in some ways we all share. You know, I think in general, we all probably acknowledge and understand how special and unique this place is, this land is where we live, and how lucky we are to be here. So just wanted to acknowledge that, and invite you all to, in the chat box, to share where you're coming from, or, as you've already done that, perhaps share a piece of land or a place, a territory that is really important to you, and why that is. So as you're putting that in there, I'll just move on to the next slides, and that's first just some background on the Next 30. And the Next 30 is a not-for-profit organization. It was started by a small group of Albertans who were concerned about the direction of the province and the future of the province, and wanted to create a space for people to have conversations, to share ideas, encourage policy alternatives, and stimulate more positive and productive public dialogue. So that's the space the Next 30 has created, and we launched the Next 30 back in November with one major project, and that's the Possibility Panel. So this is a session of the Possibility Panel. It's a group of people who are engaging on these range of topics, exploring what's possible for the future of Alberta, how do we want to face the future, and what big ideas should we pursue. So this session is one of those, is one of the meeting places, I guess, of the Possibility Panel. And the role of the panel is partly to share their ideas, but primarily to listen to the ideas that are being shared in these sessions. And so we'll, as I said, we'll hear from a few panelists at the outset, and then we'll hear from a few more toward the end, who will share a little bit of their reflections on what they've heard from you all in this session. All of the input here is going to go towards, we don't know exactly what it's going to look like, the output, but there will be an output from these various sessions about some of the big ideas that have been explored through this process. So we have 7 actually panelists who will be in conversation here today. Wakefield Brewster the 8th one on this. He's a poet and spoken word artist, but unfortunately, he's also a massage therapist, and unfortunately, he at the last minute had to duck out because of an urgent situation with one of his patients. So he's really tending to health and wellness as we speak, and won't be able to be here. But the other 7 panelists are all here. So thank you all for being here. And we'll move on to one last introductory slide, I think. Oh, the values. So for those of you who are new to a Next 30 event, you'll see this is a list of the values. I won't read the details of them all, but I will just say respect, non-partisanship, diversity, long-term vision, and collaboration. On the point of diversity, it says we value the critical importance of diverse perspectives in finding solutions to the challenges we face. Some of these issues that we're exploring can be very polarizing issues, and our sense, and I guess the intention we have here is to try to find creative ideas and solutions that come when we're engaging with people who we might not necessarily agree with at the start. So I think the philosophy there is we're not necessarily going to find the best ideas if we're only talking to people we already agree with. So I really encourage you to kind of take advantage of the opportunity of being in conversation here with people who come from all different backgrounds and who may have quite different perspectives than yours. And on that note, the next slide is on Brave Space principles, and that's the principles that we invite you to have in mind as we approach the rest of the session. These are principles that were introduced to us by Tim Fox, one of the members of the Possibility Panel, and I'll read through them. You can read them on the screen as well, of course. Just to say this is this kind of space that we're hoping these sessions will be. So we kind of take responsibility and encourage you to take responsibility for living up to these principles and holding one another accountable for them too. So we're present in this virtual space with each other. Try not to be too distracted while we have the opportunity to be here together. We're open to new ideas and ways of thinking and feedback. We listen deeply and are curious, and we seek new knowledge and understanding. We bring awareness to our own biases, assumptions, and judgments, knowing that we all have biases, assumptions, and judgments. It's a space and we hold a space of trust and confidentiality. And so we really encourage you to keep confident in the sense of the who said what in these sessions. Of course, we encourage everyone to share their ideas and encourage you to be brave in that. There's another one of the principles, and to sort of to maintain that trust and confidentiality. We focus on possibility. That's a big theme, and you'll hear more about that. We acknowledge and appreciate each other's gifts. We challenge ideas, not people. So surely there's going to be some disagreement here among people on these sessions, and encourage you to challenge the ideas, not the people, and to allow for the possibility of discomfort, because discomfort will lead to growth. And finally, I've already mentioned, we take accountability for our own learning. And the only other thing I'll mention on this is that I think, we'll see, I guess, in a moment, but I think we have some young people that have signed in here, and we like to highlight that fact because it's important to make sure we create a welcoming, inviting space for the young people as well. We're talking about the future. We're talking about the next 30 years for this place. And it's really important that we hear the perspective of people who have the greatest stake in that future, young people. And they may or may not be used to engaging in these sessions, depending on their experience and their age and so on. So if you find yourself in a small group with some young people or with a young person, I just really encourage you to help make them feel welcome and invite their perspective. All right, so the last little intro is the Slido tool. And here's where we're going to be putting questions in, doing some interaction and sharing ideas virtually. So You can go to slido.com either on your phone, which is probably easiest, or if you're doing it on the computer, you can have a separate window open, and you go to slido.com and you enter the code #next30, as it says there, and that'll bring you into the room that the questions are from this session are presented in. And when we get to a moment like that, then you'll have an opportunity to share your response in that form. We'll do that in a few minutes. Actually, I think we're going to do one in just a moment here. So that's all the opening. Right, here we're going to test the Slido tool. So if you've gone in there to slido.com, #next30, then please enter your response to this, indicate your age range. And this will give us a sense of some of the demographics of who's on the call here. So I'm just going to give a minute for people to do that. And there you can see the answers starting to come in. We've got quite a turnout from the 55+ crowd tonight. Welcome, everyone. And that's good to know. It looks like we had a pretty small turnout from the under 25. So yeah, someone's just mentioned not a single under 25. That is interesting because there has been at other sessions. So we will dive in now into the topic here. And I think we all sense that, you know, health is a hot topic these days for obvious reasons. I think we've also understood through this pandemic just how much health really is the issue. It's an issue that underpins everything. It underpins the economy. It underpins our relations in community, and so on. And in so many ways, it's such a major factor in. Oh, look, there's a dog on the screen. I don't know if that's just me who can see that. Anyway, the health issue is paramount right now because of the pandemic, but the pandemic has also revealed just how much health and wellness issues interact with so many other issues. It's also, like many of the issues we've been exploring, it can be a very polarizing topic. There are all kinds of different ways that we can quickly get to very kind of emotional, divergent points of view on lots of different aspects of this. And so we need to just hold those tensions as we enter into the conversation, and really try to focus ourselves on possibility. The overall theme of this is possibility. So we'll be really exploring what's possible for the future of Alberta related to this topic, and exploring it through that question. So we'll skip ahead to the panel session, the panel now, Stephanie, if that's okay. It looks like you're having some technical issues anyway. And we'll dive right into introducing the members of the possibility panel, who are going to each share 5 minutes on the topic before we get into the details. And I'll just remind you, if you have a question for the possibility panelists, as you're hearing their topics, you can enter those into Slido as well. And so I'd encourage you to put prepare your questions that way. So there's the prompt to remind me, because I always seem to forget to tell you about the Q&A in Slido. There you are. I just want to double check to see if Haley is actually with us.
I am here.
Oh, okay, great, Haley. Glad to have you. So Haley Wickenheiser is, well, a final year medical student, an advocate on many issues, especially related to sport and many other topics. She's also played a little bit of hockey, you may have heard. And we're really pleased to have Haley here to share her reflections on this topic. So take it away, Haley.
Okay, thanks. Thanks, Chad. Hello, everybody, wherever you might be. I just have to tell my son to now you have to be quiet. Emptying the dishwasher. Anyway, hope everybody's doing well wherever you are tonight. It's good to have my few minutes to spiel. I guess health and wellness is something that I'm pretty passionate about. It's been my life. It's been a massive part of any success that I've had. And I guess I see it now through the different lens, which is a lens of being in medicine and inside the healthcare system, which has been quite interesting to be in my final year of medicine in a pandemic. So, you know, I grew up in rural Saskatchewan, and I know what a small town life is like, and I appreciate that Alberta is not just made up of, you know, 3 or 4 major cities, but there's also many rural communities that are mixed in with the rest of Alberta that matter too and are incredibly important. And, you know, my parents were teachers. So my life on the weekends was spent going to the schools, and my dad would open up the school, and that's where we would play. And I did every kind of sport imaginable at the school during that time. And that was how I fall in love with sports, not just hockey, but all sorts of sports. Sorry, no, you can just leave it. I'll do it later. Sorry, everyone. You know, I think the first thing I think about when I think about health promotion and wellness is looking at from an education perspective in our schools, and that I believe that mandatory phys ed should be happening in all ages and grades. I think it's mandatory to grade 10 in most schools, and then it stops. I like to see mandatory phys ed in all schools. I'd like to see kids having a few more recesses, getting outside to play, really encouraging activity. Because one of the things that we see, and I see especially in the family med clinics that I go in and out of through my rotations, is this increasing sedentary behavior. And of course, now we're in a pandemic, and we're not able to do the things that we used to do. But this is something that is pervasive in our society. So that would be the first thing. I think the second thing too is I look at movement and health and wellness through the lens of movement, which is what I'm going to mostly focus on. And I think that movement is medicine. And I would love to see in our curriculum in medical school the ability for physicians to actually prescribe movement and medicine, movement and exercise. We prescribe a lot of drugs, which sometimes drives me crazy. But I believe that we can sort of shift our mindset from a reactionary healthcare model to a healthcare model that is on prevention and promotion of movement, activity, and wellness. That's a very massive topic, very complex, but I truly believe that. And I think that that's something that, you know, moving forward in my career in medicine, that I'm going to look to do for my patients is to how can I deprescribe as much as possible, and how can I prescribe movement activity in medicine. And so I think that theme, that topic are things that are really close to me, to my heart. The last thing is accessible communities. So I was inspired by the 88 Olympics in Calgary. I was disappointed when Calgary didn't bid for another Olympics. I know that's a very tenuous topic, but I am a member of the IOC, and I get to know what goes on inside the IOC. And I think the Olympic Games are incredible. The legacy that the Games have left in Calgary has been enormous and incredibly beneficial for every citizen of this city if you want to take advantage of the facilities that there are to offer. I think that we should continue to be proactive in going after major events. So the X Games, the Olympic Games, hosting events that encourage wellness and activity, which help to further walkable communities, help to further, you know, things like bike lanes and ski parks in cities, and just getting our population in general moving. So I think that's my theme, is movement is medicine. Those are the 3 areas that I would talk about in my 5 minutes. Yes, I understand that there is much more to wellness than movement and exercise, but that's what I'm going to choose to focus on for the 5 minutes that I had to say today. So back to you, Chad.
Okay, thanks, Haley. That's a good synthesis point. Movement is medicine. That's great. And I'm sure people will have some questions for you in the Q&A when we get to that in a few minutes. Thank you very much for your opening comments. Next, I'm going to turn to Dr. Kerry Novak. She's an academic gastroenterologist. I had to practice that word, Kerry. And at the Foothills Medical Center in Calgary. Also So a doctor, a researcher, and pioneering new tools and innovations in the field as well. And she might speak a little bit about that. Over to you, Kerry.
Thank you, Chad, and thanks for everyone being out tonight. It's finally warming up. So many incredible notes in the chat. I'm writing down as folks are commenting. So quick bit about me. I'm a specialist doc who works mostly in the hospital. So I spend my life in acute care, but over the last 10 years have spent a lot of time working closely with community docs and primary care, because that's where health lives. And so I welcome the opportunity tonight to brainstorm and chat with you guys about my perspectives. I've tried to get some thoughts from other very clever people, data analysts, experts, and leaders in the health system. This is an incredibly complicated problem or challenge that we all face. And you know, really, COVID, as Chad nicely has said, has provided a lens both to highlight the challenges that we face, but also really to highlight our strengths. And I have to really give a shout out to all of the folks in both acute care and community care for the work that they've done. I know we're not out of the woods yet, but the vaccine is in sight, and we have an incredible medical system. When we think about health, obviously there are so many components of health, and coming from the medical system, I think we have to come back to what is the definition of health and what do we mean by that. And wonderful comments again about the importance of the determinants of health, you know, access to healthy food, walkable communities, livable wage, all of those are the foundations of health. But what those foundations are built upon is primary care. And we have one of the most innovative and fantastic primary care health systems in Canada. Lots of provinces look to our primary care health leaders to say, how do you do this? How do these systems work? The connectivity to a primary care physician, the focus on multidisciplinary comprehensive health care, and access to primary care. I think in the next 10 years, one of the single most important things that we do to maintain health, keep people healthy and out of hospital, is to support primary care. And there are disparities in the way the systems of health delivery in this province are funded. And that's a really important focus. All is not perfect. And obviously this is a political hot potato, as someone nicely articulated in the chat. We're on a 4-year cycle, and often it is one of fear as to what's going to happen next. We're in a situation now where folks are trying to anticipate each next step in different ways in which the system is funding. And what I guess I hope we can take away tonight is the courage as Albertans to say not what's political, but what's important and what we're going to bring forward as ideas to enhance and change the system. One of the things that's really important to understand is actually we have a fractured system. As incredible as it is and visionary to create a system across the province, Alberta Health Services is a phenomenally innovative system that unites acute care across the province. But it's siloed and separate from community-based healthcare provision. The primary healthcare I just described, there aren't enough substantive mechanisms to link those, from information systems, even to accountability and budgeting. When you have separate budgets that fund those separate systems, yet they rely on each other, that doesn't work. So system integration is my number one hope to take away tonight as far as ways in which we can improve the medical system. The second one really is about data and leveraging data and data analytics. We have more power today to collect data virtually from people's home, from walkable devices, from your own computer and your phones, and leverage that data to inform healthcare delivery services, from operations to how we measure whether or not we're actually doing the job that we promised you we would do in the health system, and that's to improve your health and improve your health outcome. We spend a lot of time in measurement looking at process measures like access. What's the surgical wait time for X surgery? And those are easy. They're lovely sound bites, but they're not necessarily meaning to say that this surgery improved this person's outcome, their quality of life. So we need to do a better job of actually measuring elements that matter to Albertans and then using those to inform the way the system is delivered. The last big item I want to mention is probably one that's very complicated and there's no one fix for all. I'm a salaried doc. So one of the things when we look at payment models is how do incentives work and how does accountability work? There is no doubt that we just have to look over the fence at our neighbors to the south to understand how fraught the private system is. So I'm a huge advocate of our publicly funded system. There's no doubt about it. But I think we can really innovate around how providers are paid. And importantly, think about better ways in which to make providers accountable for the costs they incur. Every decision we make has a cost, every imaging study, every lab item, all the things that cost and potentially impact patients should be accounted for in addition to what happens to the patient and their outcome. It needs to be tied to what we do. And physicians are industrious and clever individuals who work incredibly hard and care very, very much about the health of Albertans. And many are open to new ways in which to be funded. And I think current funding models can evolve and we can innovate around those. Lastly, I'm running out of time very quickly, but for sure, our delivery system, our leadership has to reflect the incredible diversity that we see on this call and that we see in Albertans. And so equity, diversity, inclusion, these are fundamental principles that we have to go forward on. And we have to make sure that our leadership within both community and acute care health services reflects Albertans and what Albertans need. There's some amazing comments about race and gender and equity and poverty and all the ways in which people are marginalized we have to address face on. And I think we're trying to do that. So I've bitten off more than I can chew, I'm sure, and I look forward to the question and answer period. Thank you, Chad.
Okay, thanks, Kerry. That's a lot to seed the conversation. Really appreciate that and the perspective you're bringing from your standpoint in the system. One of the things you mentioned there was data, and that's a nice bridge to our next panelist. So I'm going to invite Corey Jansen to speak. Corey's the co-founder and CEO of Alta ML, which is a developer of machine learning applications, technology solutions, which of course have applications in healthcare. So I'm sure, Corey, this is a bit of a different perspective from the one that Haley and Kerry have brought so far, and invite Corey now.
Thanks, Chad. Yeah, that's right. I'm definitely not a clinician, and I'm just an entrepreneur that's losing more money in the healthcare sector than in any other industry we participate in. But we feel that there's so much opportunity there. Everybody says we're crazy dealing here, but it's just the potential is just too great. One thing I'll put out there: we're not going to build a sustainable system by cutting. I also don't think we'll be able to get there we just don't have the money especially when you look at diabetes and some of the other chronic conditions that are coming. I mean, the system is going to collapse unless we change. It seems like one of the biggest factors, and not the only factor, but one of the biggest things that we have to do is just make better decisions. And making better decisions, I think that one key area that can play a role is in the use of data and AI. A lot of people don't realize the potential that we have here in Alberta. Yes, we've got a very, very small population at about 4.5 million people, but it's a diverse population. And we're one of the few places in North America, if not the world, that has that diverse population under one health authority. We've also got some pretty good data scientists, if you haven't heard already, coming out of the U of A. We've also got world-class researchers, both at the U of A and U of C, all the research universities in this province. So you put together that domain expertise with the data, with the data scientists. On paper, we should actually have something that works. There's a few barriers. And we've touched on a little bit in terms of innovation. I don't, there's certainly and I want to say this the right way, there's a lot of amazing things at AHS. I don't know that my experience as a small entrepreneur, I would say that the system is set up for innovation. I think that the system, for a lot of right reasons, is set up to do other things well. But I think there's probably, if enough Albertans, pushed for some leadership to really say, listen, we want to be a place where health innovations are developed. We want to be that place where we could be that first customer. We want to provide, say, where with the right guardrails that we allow entrepreneurs and researchers to be able to build the tools of the future. I think that would not just serve Albertans and our provincial budget, but I think that could actually open up in a whole new industry. Yeah, a big reason I'm part of this panel is because I've got a 13-year-old daughter and an 11-year-old son. And frankly, I'm not so sure that they're going to be around in Alberta in a decade if things don't change. And health is one of those areas that I think we could actually have an edge in, and we could be, a center for that, the intersection of health tech. The second thing, other than the system and just this focus around innovation, I think is fear. People would rather have their bank account information posted on the internet than their health information. But we've got these misconceptions of AI. Everybody thinks of it as that Hollywood script. In reality, if you're building an ML model, the last thing I want is your personal identifiable information. Your name doesn't help in the model. And there's a whole bunch of different ways around it. By using aggregated anonymized data, that's where you can actually get some real benefits. But it's an education piece, because the second people hear about AI working, all of a sudden you start freaking out. But the number of use cases we've seen from, a lot of people have heard of, are aware of the imaging, but we've had 3 or 4 use cases in oncology. Things like recurrence of lung cancer, working with bone and joint on predicting severity in hip fractures, a ton of use cases in digital pathology. You talk about primary care networks. We didn't get this project off the ground, but it was with a large pharma company actually using data to actually predict frailty, put a quantitative so we make sure grandma stays out of the hospital and closer to the community. Data can play a role there. And a number of other ones that are all adjacent to the system, especially within organizations like an insurance system. So we have some amazing, there's some amazing assets at AHS within our data. There's also lots of organizations. I'd point out, just from scoping around in the room, I know Christy Holtby is here from AMI. So if you're not sure of AMI, it's AMII. This is the machine learning whizzes out from the U of A. I shouldn't say whizzes, but they're the smart ones, right? And Christy is in a unique position here. Sorry for calling out Christy wherever you are, but she actually knows the healthcare system and knows AI. So if you're in her group, pick her brain. And I think I saw Crystal Phillips from Thin Air Labs. So Thin Air Labs in Calgary, doing some really, really cool stuff at the intersection of health and AI. So I hope that we can at least start this conversation. And if nothing else, I really want to drive forward this message of, once we educate ourselves, it's less about fear and more about the potential. And we can actually have our cake and eat it too. We can lower our costs while improving patient outcomes, in many cases by using AI and data at the core. Thank you.
Okay, thanks, Corey. That's great. And we have one more speaker to hear from. And just before I introduce Salima, I'll just encourage you all again to, I can see that the chat box is being used a great deal. So good job on that. And I think there's even some good healthy debate on there. I also just want to remind you about posting questions for the Q&A. So to Haley, to Kerry, to Corey, and then to Salima. So there are already some questions posted. Not only can you post your questions there in Slido, but you can also vote up the questions that you're interested in seeing answered. Oh, thanks, Stephanie. There you can see how it's shaping up there. So there's a question that you're thinking, oh yeah, that's a really good question. I'd like to see that answered. You can click on it and it'll just get noticed by the system. So, but before we go to the Q&A, I'll now turn to Salima. Both Haley and Kerry referred to elements of the, I think you called it the social determinants of health, Kerry, and the way Haley described the movement as medicine was an example of that in community building. So I think Salima has some perspective to share on that. Salima is the executive director of the Sunrise Community Resource Center in Calgary. And welcome, Salima.
Thanks, Chad. I'm so happy to be here again. I love everything that the Next 30 group is doing, and I really appreciate all of the hard work that the volunteers behind the scenes are doing to make these conversations happen. Thank you for having me. I love everything that has been said so far and the awesome conversation that's happening in the chat. The idea that health actually lives in community, I thought that was amazing, Kerry, and so true, that the two are incredibly connected. I'll start with a story. So a few years ago, about 2 years ago, I got, that horrible phone call that I hope no one gets, but unfortunately probably all will get at some point in our life, where you answer and it's the hospital calling and you need to get there right away. And so my dad had a heart attack. And so I got a call, said, please come to Foothills right away. I made my way there. I arrived there and I was greeted by one of the volunteer greeters at the hospitals, right? This is pre-COVID, thankfully. And so I was greeted by one of those volunteer greeters, and that person asked for the name of who I was looking for. And they sort of, they heard a Muslim-esque name and they went with it. And they brought me back past the ER reception desk and through the doors and back into the emergency area. And then we immediately turned right, and they took me and they said that my father was through this door. And I was like, oh, okay. And it seemed really weird to me because it was a super concrete door. You couldn't see through it. There were 2 police officers sitting right there at a desk. And I was just like, this doesn't seem right. I was prepared for walking into like a hospital room, right? With tubes and all of that kind of stuff. So I opened this door and there's this young woman sitting there, and she's just sitting there. And she's got bandages on her arms, and she's just sitting there in this concrete room with, very little light and this room. And I was like, this is not my father. Can you please, I closed the door very quickly and I was like, I'm sorry. And I left. And I said, this is not my dad. Can you find someone else? And it stuck with me. It was just, what is going on here? So this is what we do when someone is in a mental health watch and in a suicide watch, is we put them in a concrete room for 24 hours. Is that really what's happening? I was quite confused as how is this even possible that this is happening? And I'm sure that there has been a lot of design and thinking, and I'm sure there's 1,000 reasons why this is the way the system works. But just as from a human perspective, as an individual human being, it seems like there's something wrong there. And when we dig into that, I think that's one of the major themes that I think we need to focus on when it comes to the future of our healthcare, and that is what are we doing around mental health? I know there's a lot of activity happening right now, and I think it's amazing. I think the access lines that are being launched and the Bell Let's Talk initiative, all of that stuff, I think it's amazing that we're looking at mental health in a lot more holistic and wide way. However, I do still think there's a lack of the emphasis of psychiatry and access to actual psychiatrists and psychiatry and professional help. That seems to be a gap, I think, in Alberta, that we just don't, for some reason, we don't seem to have access to that. It seems to take a really long time to be able to get that kind of help. And we tend to, why isn't there a psychiatrist available, you know, at the hospital, like to be able to help with, like, why is it always just prescriptions? So I don't know much about this. I'm not an expert in this field. I hope you'll forgive me if I've talked out of turn and I've said anything that isn't correct, but that was my experience. And that's, I think the experience that I've heard from other folks in my life is just that it is very hard to access actual psychiatric help in a timely and an effective way in Alberta. Okay, so that was my little story, and for me, that story for me really focuses, you know, talks to the need to focus on better mental health interventions. It also made me think, why, you know, why are we so disjointed? And I think Kerry has already talked about this, the idea that our social determinants are not connected often to our health outcomes. I think the WHO has called Canada on this a few times over the years, just being like, yo, you're not going to get anywhere on health if you've got people who are hungry. You're not going to get anywhere on health if you've got people who aren't able to be housed. And so that's all that. Thank you for bringing all that up. And I think that all, for me, very much resonates. I do believe, of course, that poverty and health are connected. And I believe that our safety nets, as Kerry pointed out as well, and a few other people might have pointed out in the chat, are disjointed. And they're a patchwork. And we really have to get our politics out of this patchwork and make it more, as Corey was talking about, we need to base it in data, we need to base it in science, we need to be leaders in research rather than shifting our gears every 4 years. That's not serving anyone, I don't think. And I think that another big possibility for us all is to really look, and I think everyone is working in this way, but really we got to work at all the intersections, right? And that systems integration that we've been talking about. We've got to work at the intersections and make sure that something that we want to see in health is also something that's reflected in our culture, that the arts are involved, that community is involved, that there's a lot of layers of transformation that has to happen in order to actually solve a social issue or a health issue and get to a better outcome. It's not one sector alone, it's all the sectors. So if we actually want to get to a place where we don't have poverty in community, then it takes every single sector to get there. If we want to get to a place where we're not seeing, where our health outcomes are actually leading the world, then it takes everyone getting there and understanding that it's a holistic journey and that everyone needs to be involved, including art and artists, as well as including understanding indigenous ways of knowing and integrating all that our Indigenous communities have to tell us about health and wellness into our current system. Thank you. I think I went over 5 minutes, I'm sorry.
It's okay, thanks, Selima. It's great, thank you for sharing the story and then connecting it to the broader issues as you did there. So I know that there are medical practitioners in the room on the call. I know there are people with a lot of experience in health in different dimensions of it. And I also know that there are lots of people, of course, with experience as users of the healthcare system. And we're talking about it as broadly as we are here with some of what Haley talked about at the start and Selima just now. We're all members of a community that is where the healthcare is connected to all the things we experience as community members. So all that means that I'm encouraging you to put in some questions and to vote up the questions you're most interested in, and we will have a chance to get further into the discussion in breakout groups. I'm just going to moderate the Q&A for a few minutes here, and so I'll start things with actually the question that appears second there, and I'm just going to direct it to Haley first, and then if anyone else has an answer, that's great too. How do we make physical activity and sport accessible? This is from Laura B. I teach little kids to Nordic ski, but it requires dollars and gear, which are not all kiddos have access to. Have any reflections on that, Haley?
It's the billion-dollar question, I suppose. Well, I played a sport, I work in a sport that's probably one of the most expensive sports, hockey. A pair of skates these days, a brand new pair of skates, I think is about $800 or more. So it's not an easy thing. I think it's a combination of public-private. I mean, if you look at an organization like Jumpstart or Kids Sport, what they have done to get kids across that barrier of access to sport is really incredible. There's some great grassroots programs out there. I like to think, one of my dear friends, Becky Scott, runs a program out in Canmore, getting Indigenous youth into cross-country skiing, and they've had incredible success doing that with public-private partnerships. There's lots of ways to do it. I think, it needs advocacy, it needs probably tax breaks at certain points, and as well as private corporations stepping up to help out if families can't afford it. I did notice a few comments in the stream about Scandinavia, and I lived overseas. I lived in Sweden for 2 years and Finland for a year. And the way in which they integrate their children into not only school system, but into physical activity in the community, there's not really barriers to entry as there is here. There's a lot of things I think that we can learn from other countries in the world, and the way in which sort of the socialist economy allows that to happen. So, my dream for Canada is that any child that wants to play a sport activity is not unable to do that at a young age, that we can get all kids moving and trying different sports. Obviously that's a pipe dream probably, but there are ways now and organizations out there. And so good on you, Laura, for coaching and being involved. And I think that's another great point, is our sports system in this country is mainly run on volunteers. Minor hockey is all moms and dads and volunteers. In other parts of Europe, the best coaches in the world, it's not a demotion to coach the youngest children. They're actually paid to do that. And so we rely on volunteers and people stepping up to do it with most of the time no pay. And that's just also an incredible contribution as well. So good on you.
Okay, thanks, Haley. It connects to your earlier point about phys ed classes in schools too, I guess.
Yeah.
Okay, let's just because there are a lot of questions now. Way to go, everyone. I'll just jump to the next one. So the top question there: what are your top 3 ways of promoting integration between primary and acute care? I might go to Kerry first, assuming you might have something to say on that, and then anyone else as well.
Sure, it's a brilliant question, and just as a quick caveat, I'm not an economist, and I don't have policy training. I don't make policy, but I think there's a couple of different ways in which we can conceive of this complicated problem. So one is how our system's funded. So when you have totally separate funding streams, you have separate levels of accountability, you have separate or siloed reporting. And then what happens is you have barriers in understanding. So you have an understanding problem or mutual understanding challenge. So one of the first things I think that we need to do is bring everyone under the same tent. So that would be number 1. I think number 2 would be an innovation around care delivery. Now here's a showstopper for you. Imagine if we created care delivery that was totally focused around where the patient or the individual lived, where their community was, if we brought care to them. So I say that's a showstopper because really what we do is we make the patient come to us. So even just in the formation of the idea of, imagine if you had a complex chronic disease individual who needed multiple care providers, and you brought them all virtually or physically into the community to provide care. So if you create physical structures and virtual structures where you can have collaborative, multidisciplinary care, you create integration. So a gastroenterologist, a cardiologist comes to your primary care medical home where there's a nutritionist, where there's a physiotherapist, where there's a rehab specialist and a treadmill, and you get rehab for your cardiac disease. I think the third way in which we can think about integration is to change the way we incentivize or pay individuals that participate in these systems. And I think that human nature is such that we need to incentivize health promotion and disease prevention. And that will help to integrate the systems and certainly weigh on health promotion and prevention side. So I'm sure other folks will have very clever contributions as well.
Thanks, Kerry. I think Corey has a thought he wants to share here. Is that right, Corey?
Yeah, and there's one example in this area here. Again, it's a big system, big problem, but I'll just share this one situation because it's local to Edmonton and we were involved in it. So you could Google around a year and a half ago, as myself and Mayor Iveson and the head of Canada for Boehringer Ingelheim, a German pharma company, as well, on the stage to announce this new initiative. And you know, is I think I alluded to it around frailty. So there's some really good research at the U of A, you know, providing a quantitative metric for frailty. So it was going to be the Oliver PCN. So you know, one of the local primary care networks locally in Edmonton, and Health City sort of spearheaded this. So you had all these different players coming together to say, okay, we got funding coming from outside, we got these pieces, and it just fell apart, like, because you had the academic piece and you had, you know, trying to work outside of AHS between the PCNs and all that. What could have been the result is actually doing, you know, building technology that would have been light years ahead of what's in other jurisdictions. And we could potentially have built that tool and then exported that around the world. Instead, what's going to happen is we'll be the laggard, and we'll have to purchase that and pay that from somewhere else. So instead of being on the cutting edge, you know, that innovation, that culture, and that mindset in the system, I think sort of for a variety of reasons just called this project to fall apart. So that's one specific example in terms of, you know, keeping seniors out of the system, where technology might have been able to play a role, leveraging off of local talent that just didn't get done.
Okay, thanks, Corey. It's a good illustrative example. I'm going to move it to the next question because I just want to make sure we get through one or two more. And Laura B seems to be posing popular questions. So we're going to go with hers again. The next one, how do we consider, use, and leverage proactive approaches to health and wellness, such as incentivizing healthy behaviors and using alternative treatment modes? And I'll just see if anyone wants to jump in with some initial response there. Okay, Salima, go ahead.
I love this question just because I'm a big fan of behavioral science and behavioral economics and using tools like incentivization and nudges to actually create both systemic and individual change. So thank you, Laura B, for this great question. And yeah, and I think that as alluded to, we kind of have to change. I think we have to change how we think about how we pay for and fund what we want to see in our society. So I personally, when it comes to trying, I believe that in order to help people move out of poverty, I need to actually give them some incentives and some room in their lives to be able to get out of scarcity and get out of the stress of scarcity and move into a place where they can make, where people can make different decisions and find different health and wellness because they've been able to be supported with a level of help and care and incentives. But I'm not, I've been trying to get ideas like this funded for probably the last 2 years. And it's very, very difficult. People don't want to give people money. And I think that we just need to give people money sometimes so that they can actually do what they need to do in order to get better. We see this even when it comes to inside of a health, like in a healthcare system with people with special needs. And you might want to go and purchase something for your child, but you actually have to follow a list and you have to only purchase from these vendors. And if that doesn't work for you, then unfortunately you're not going to be able to get the item that you want because, and there's, you know, and there's 5,000, you know, pieces of paperwork that you have to fill out, and even, and someone has to assess whether or not your child really needs this one piece of equipment. Well, that just seems like a lot of layers of a lot of work in order to help someone who has a special needs child get some equipment in their life. Could we just give them some money so they could do that? Could we just allow people to figure out solutions for themselves? Just something that I feel very passionate about. Thank you.
Okay, thanks, Lima. Any other thoughts from any others on that question that has disappeared from the screen? But it was about incenting behavior and in promoting alternative solutions and approaches to prevention. No one wants to jump in? Okay. I will, I'll move on to the next one. This one came up. How can you improve your health if your medical records are not owned by you, but the physician or the medical clinic? I'm not sure if anyone wants to speak to that one. Kerry, I'm going to look to you.
Well, it's an excellent question, and I think to date there have been barriers in even accessing your records, and I think the system is trying to change that, and there's a number of very well informed comments in the chat about getting your lab values, and you know, I think that in my personal opinion, I think every single health record should be available, accessible, and obtainable by the patient. It is absolutely your record. And I think there's an evolution and a power shift that comes with that that's really, really important. So I think that folks in the medical system recognize that, and I think it's coming, but it's probably slower than you would like. I am not an expert in this area. I know that through a NetCare portal and through other evolving Connect Care mechanisms, you can do secure messaging and access health records, full consult notes, imaging results. You often have to ask your provider for those. And I think that has to change. And I don't know where in the spectrum of changes that sits, but I think as Albertans, we should lobby for that. I think it's an excellent point.
Okay, thanks, Kerry. I'm just going to ask one more question, and I know that unfortunately we won't get to all of these here, but we are going to shift into the breakouts in just a moment. So hopefully you'll get a chance, if you don't get your question answered, you get a chance to sort of get into a conversation in those groups about some of these points. It's a bit of a different question, so I'm just going to jump down to the third one there. As a kid who was ridiculed and bullied in PE, I guess phys ed, and who had early medical issues and my doctor didn't recognize, how can we make it a kind place for kids? Motion equals lotion. I think that focus on kindness is a different perspective than we've been talking about so far. So I just want to invite anyone to respond to that. I don't, Haley, maybe you have any thoughts on that?
Sure, yeah. I mean, well, I grew up, as I said earlier, my parents were teachers. My mom was an elementary phys ed teacher. So I heard plenty of stories growing up about what happens in the gym class. You know, this is difficult. I mean, I think the onus is ultimately on teachers to create a culture. It comes down to culture, right? Like what kind of culture and environment do you want to create for children to learn and to play in? I think there's a little bit more awareness and visibility and less tolerance for those bullies inside the classroom. I know, coming from a teacher family, that I think that's being confronted and dealt with and taken more seriously than when I was a kid going to school, for sure. So, you know, kids can be very cruel to each other. There's no doubt about it. And I think it's up to all of us as parents and as teachers and as community leaders to keep spreading the messages of kindness and of you know, intolerance for those types of behaviors to create a culture that we ultimately all want to be a part of. You know, I don't know that there's a one answer or an easy answer, but inclusivity and creating an environment where, whether you're a star athlete or a kid that can barely put one foot in front of the other, every kid has to feel welcome. I know when I played on the national team, the best teams that we ever had that won and performed well was an environment where every player felt they could be themselves, regardless of who they were, where they came from, young or old, or their abilities. And so I think that those types of cultures foster great learning environments wherever you are, whether it's the school, the hospital, or anywhere else. So that's what we should all strive to, I think, try to create every day. It takes more energy to be miserable than it does to be kind.
Okay, great. Thanks, Haley. Well, thank you very much. Before we close this, I want to ask Steph to leave this up for just a moment longer, because I'm going to read one of these questions in a moment. But I do want to thank all four of you for your contributions here, and obviously from the questions, you know, that your comments really seeded a good start to the conversation. So very much appreciated that you shared your comments, your perspectives, and came from such different points of view on this. And hopefully you'll be able to stick around for some of the conversation that follows from here. But I'll say thank you to you right now. I'm just noting Grant Fedorik's comment here, and we won't have time to actually get any of you to answer, but I'm just going to read it because I think it's a good kind of rhetorical question in a way to leave this with, given that we've heard so much about the different perspectives here. I happen to know Grant is a physiotherapist. So his question is, why is health a separate government portfolio from education, justice, children's services, and environment when they are so significantly intertwined? And I think that's a really interesting question to kind of wrap this up with, just sort of lingering as a question, because we've been talking so much about the interconnections of health with other dimensions of well-being here. So thank you for that, Grant. And let's move on to the next section. Stephanie, thank you. So we'll move right into the next section that's called How Might We? And this is your chance to now, having heard some ideas, having seen a lot of chatter in the chat box on these topics, to now go in to small groups and share some of your own ideas and reflections. And I really encourage you to do that. And then when we come back, we'll be harvesting ideas from everyone through Slido. And that's really important for generating an insight from the room. I think one of the comments in one of our earlier sessions was the smartest person in the room is the room itself. And so we just want to make sure we create an opportunity for everyone to be heard here. And this is the moment to do that. So how might we improve health outcomes and lower healthcare costs through prevention and innovation? Just a reminder, that's the question. So you'll be exploring that in your group. The next slide just gives you a little guide, I guess, to that. So I've shared this at past sessions. Apologies to those of you who've been at the earlier sessions. It's just a framework to keep in mind as you're going into these small discussions for how to go into a conversation like this with a group of strangers. And there's sort of 4 quadrants to this, where there's sort of ways to get into a conversation. On the bottom left in pink, it's a conversation that's mostly characterized by talking nice. So that might be typical in a room of strangers. You don't really know each other. You're sort of quite polite. And we welcome politeness, of course, but we also want to invite you to get into a somewhat richer conversation than you might be if you're all just talking nice to each other. In the green is talking tough, and that's where it's mostly characterized by debate, where you're listening to the other person's idea mainly to find the holes in it so that you can elevate your own or come back with your own point of view. And you know, both of those are, we just encourage you in these breakouts to kind of move beyond those and try to get more into reflexive dialogue, where it's characterized by inquiry and curiosity. Like, that's the frame of mind you're approaching it. And even better, the generative dialogue in the upper left quadrant there, where it's really about co-creation, where you're listening to other ideas and trying to build and connect them to your own ideas and so on. So that's just an encouragement for how you go into these conversations. And I'll just show the next slide. This is the process you'll have for about a half an hour or so, or just under half an hour. And first of all, it'll be about 5 of you in the group, somewhere between 4 and 6. If you could just take a couple minutes to introduce yourself, where you're from, and then do a round where you share an insight, something that resonated with you from the panel session, or a question you're asking yourself as a result of it. So each person to share something like that. And then another round where you share your personal story in relation to this topic, why this topic matters to you, what's your experience been. And then finally, a group discussion where you're sharing some of your ideas that you find most compelling, and that you know, connecting to others' ideas as well. So you'll get, when you're in your breakout group, you'll get a little prompt to tell you, okay, now's roughly the time to get into sharing your insights or sharing your personal story and so on. And that's just to help guide the conversation, because there are no facilitators in the breakout group. So this is a moment for you all to kind of take responsibility to steward the conversation and make sure everyone is heard. So with that, I will set things off, or Stephanie will set things off, and you'll get a prompt to join one of the rooms now. See you in a few minutes, 25 minutes or so. Okay, welcome back, everyone. I hope you had some good discussion in your breakout groups. I could tell by the mixture of people and perspectives that there was some diversity of opinion. I hope it looks like everyone made it through those discussions. So kudos to you, and I hope you found some good value in exploring different perspectives on these issues. We're going to, it never feels like these breakouts are long enough, I think, for most people. So I'm sorry we had to cut that a little short, but we just want to make sure we do wrap it at the hour as we had committed to do. So consider this the start of the conversation. Right now, we're going to move into harvesting your ideas, and so we've heard a lot of discussion from the panelists in the Q&A, in the chat box, about lots of different topics, from the healthcare system itself to physical activity and sport, to mental health and poverty, technology, food, lots of different topics that relate to this. So now what we want to do is get your ideas into the mix here. And the way we'll do that is through Slido again. So I'll encourage you to open that up, and this will be the question that you'll find there. Before you answer it though, just hear me out. I'm going to share an example of a response here. But what one idea do you find most compelling to improve health outcomes and lower healthcare costs through prevention and innovation? So this is your chance to kind of put your either the idea you heard that you find most compelling, or your own idea that you really want to kind of share. And I just want to encourage you to take the full 300 characters, which is what Slido allows. So that's just a little bit longer than a tweet, I guess, to put your idea in a little bit of detail in there. So just from past sessions, we've noted that sometimes if we don't give that little tip or guideline, then people may answer this with a one-word answer. And although we still welcome that as well, it's a little bit harder for others to get a sense of what you really mean if your response is just a one-word answer. So there's an example there. Use big data, that was from earlier. So with a little bit of an elaboration on what the idea is. And that was just provided as an example, more of a form for your response. So that's the kind of thing that we encourage you to respond with when we get to Slido now. So I'll just again point you towards Slido, and that question should be up there, I think, now, or will be shortly. And yeah, it looks like there are already some responses coming in. And once again, in addition to sharing your own idea, we encourage you as well to put a little thumbs up beside the ones that you find really compelling as well. And that'll give us a sense of which ideas the room here feels are most interesting and compelling in terms of this question. So we'll give it a moment. I see about 15 people have responded so far. And you can all start to see them as they come up. So there's the point about integrating electronic health care records between primary, acute care, and allied health practitioners. Empowering the primary care and family care person to lead interdisciplinary holistic approach to health and wellness. Seems to be a well-supported idea as well. There's the one around big data. Tackle poverty and inequity. As a system, we are only as healthy as our most unhealthy citizens. Here's another one. It was sort of hinted at, I think, earlier, but here it's explicit: a universal basic income. We just need to give people, whoops, jumped around for me. Just need to give people money so that they have access to improved quality of life, better housing, less stress, improved mental health outcomes, and social inclusion. Eliminate inequity. Build prevention and holistic view of health and wellness into our health system. We need a culture of this thinking by all players involved in making the system work. Now there are just over 30 responses and more than twice that many people. So I'm still going to give you time to put your answers in and to vote up the answers you find most interesting and most compelling for Alberta, the future of health and wellness. Empower people to be more accountable for health outcomes. We all have roles to play. Sometimes I feel like we default to what the expert says versus listening to our body and soul and being proactive and collaborating on health. Current transformation in continuity of care enabled by integration, data analysis, access to personal health care records, and connectivity is paramount. To promote kindness and empathy, to get people to adopt healthier lifestyles, and to advocate for ourselves and loved ones when things fall down in the medical world. Great, so there are a few more responses coming in. Thank you for taking the time to share your ideas. This is, in many ways, the part that is going to be most useful in terms of translating all our discussion here into some synthesis and output. So really appreciate you weighing in, sharing your ideas, and voting up others' ideas as well. Remove the barriers to caring, compassion, listening, and focus on cost, data, and physician-driven services by building the systems that support healthcare like education, environment, children's services, and immigration services. Sorry, mine jumped around again. Thank you. Okay, we'll just give it a couple, well, one more minute. Get last chance to just scroll through and vote up the ideas you find most compelling. Ensure that the training on how to bring humility and human connection into practice continues throughout the practitioner's career and have heavily monitored. When we create rapport as practitioners, genuine rapport with people who seek care, we begin to encourage them greatly to create sustained change. Thank you for that. Address the systemic problems that underlie the costs of our healthcare. Without addressing poverty, homelessness, and inequity, we'll always be paying more for our healthcare system. Okay. This is great. Thank you very much for the input on this and for sharing your ideas. We're now at the point in the agenda where we're going to turn to a few more of the members of the possibility panel to provide some closing reflections. I mentioned at the start that a key part of the role of the possibility panelists is to listen and to kind of help synthesize and absorb the messages that are being discussed and the ideas that are being shared in these sessions. So we've asked 3 more panelists to do that, none of whom are necessarily experts in the healthcare sector or in healthcare issues, I don't think. Anyway, and so we'll just give them the floor now to share some of the reflections they've been hearing. First, I'm going to ask Ted Curry. Ted's the founder and president of Insight Solutions and former past chair of the Edmonton Community Foundation. Go ahead, Ted.
Thanks, Chad. That was a great, both the breakout group was great, lots of insightful comments, and then just watching the chat and hearing the panelists, really appreciate the opportunity to be engaged. Lots resonated with me tonight. Trying to collect it all is quite the task. There was lots of different ideas shared tonight. I think an obvious takeaway is it is a complicated challenge, and that's probably what makes this not an easy topic. There's lots of valuable perspectives, and trying to weave those together, I think is a big ask, and there's probably the best solutions will come from that. A few things that stood out, just to summarize. I really like the focus and conversations around prevention and innovation. Movement as medicine, bringing care to people rather than always asking people to come to the care. In our discussion group, there was a couple of really interesting comments on how lots of forums often involve the general public, or other forums involve health professionals and experts, but is there enough times where those two groups come together and see things from each other's perspectives and learn? I thought there was something really interesting in that stood out for me. And then this idea of it as viewing this more as a community issue, and integrated both a broader definition of what does health even mean, and also, tonight there's been comments made about, education and the arts and the social sector, and how all those intertwine and interrelate. I really think broadening the definition of both what health means and how we solve that collectively across those different areas, I think was really enlightening for me, hearing that. Two other comments to share as reflections. I heard both of them a little bit tonight, but also picking up some themes from other sessions, from some of the other Next 30 sessions I thought was really interesting. One was this idea of watching out that we don't fall into like these either or type traps in conversations. It felt like, we can either have better outcomes or we can save money. We sort of make everything an or statement rather than trying to find the end statement. So, maybe there's opportunities to do both. I thought that was really interesting. There was a comment made by someone about, either, again, an or statement, like either championing universally accessible, publicly funded healthcare, or involving the private sector and innovation. And I just really think we'd probably be better served if we can find end statements on those and find ways to do both, I think is where the power lies. I realize it's naive to assume we'll always find an end statement, but I think it's a good place to start, because if we start with or statements, I think we box out good ideas before we even get into it. And the other one was sort of this idea of the long game. I think, especially when you're investing in something like health, the outcomes, we need to not view costs in the immediate. So if there's two options and one costs less, but if the other one's going to work a lot better over the long term, it actually does cost less than the long term. So we need to be thinking about kind of the total life cycle of how things flow through a system, and not being misguided and judging things too quickly on cost in the short term without actually looking at the big picture, both in terms of better outcomes, but also perhaps we're getting better outcomes with cost savings if we have a long-term view. So I like that idea of avoiding either or thinking and really looking at the long game were two main takeaways I took from this chat. Thanks.
Okay, great. Thank you, Ted. I'm going to turn now to Laurie Buffalo. Laurie's counselor with the Stamson Cree Nation and also a member of the Possibility Panel. Laurie?
Thank you, Chad. Danse Atawia, Kakio, Ketatamsta Tinawao. Laurie Buffalo Nasigason. I'm here greeting each of you this evening. My name is Laurie Buffalo, and here providing some closing reflections. And as has been stated already, there are some reoccurring themes in the panel presentations that have been happening. And one of the things that I continually come back to is that words matter. More importantly, how we use those words matter, especially when we're talking about health and well-being. One of the key principles that has been shared with me in my work in Indigenous human rights has been, we live here. It is up to us to restore what is missing. It was one of the elders from Musqueam Cree who had shared that with us. They have also said, money alone will not solve our problems. We need to find other ways that allow for the healing that needs to take place. Money alone cannot do that. So in looking at some of the challenges that have been posed, they're not actually problems. They're actually opportunities for innovation. And when we look at these opportunities for innovation, realistically, in order to ensure that we're moving forward in a path of not only healing, reconciliation, but in a path that is more based on dignity and respect, we have to ensure that the system itself, the healthcare system, has become so complicated that it has almost created this air of exclusivity. And in that exclusivity, it hasn't created space for the simplicity that requires us to be able to shift our thinking. So the belief itself, when we look at healthcare and we look at root causes, some of the things that we have to acknowledge is that the mindset, the 4 quadrants that Indigenous systems follow, the mental, physical, emotional, the spiritual, the belief in itself can shift our physical biology. So when we look at illness and disease, you know, when you really look at them, especially, doesn't matter if it's Western, if it's Eastern, or if it's an Indigenous system of health and well-being, illness and disease come from the chemistry of fear. And when we look at fear itself doesn't create a safe space. It doesn't create a space of vulnerability. In order for us to branch out on these new avenues, we have to be able to create space for not only humanity, dignity, but also for the space to be vulnerable. And in those spaces, that's where courage comes alive. That's where innovation is actually founded. So in looking at Indigenous systems of health and wellness, I think that this is a solution. In our systems, in our Nehio processes, no one is forgotten. It doesn't matter how you identify. It doesn't matter what elements you might live with. No one is forgotten. Because of the principle of Wakotuin, we're all related. We all have a responsibility for one another. That includes our health and wellness and our well-being. That includes, it doesn't matter if it's disabilities, if it's learning disabilities, if it's mental illness, mental wellness, emotional illness, so on and so forth. When we look at health and well-being from Wakotuin, we actually set up and create a foundation for Mio Bematsoin, which is setting up and helping people to live a good life, a good way of living for not only themselves, but for those that they share environments with. When you look at Wakotuin and you look at Mio Bematsoin, both of those fundamental laws within Indigenous Plains Cree systems is respect and responsibility. So when we look at respect and responsibility, there's a natural foundation that is set for curiosity, for innovation, but in also honoring the relationships that exist. So we cannot expect innovation without safe spaces. Reconciliation itself cannot happen without a safe space, because reconciliation is not about shame. It's about addressing the systems that continue to do harm, those systems that continue to marginalize and subjugate. So the emphasis when we're looking at health and well-being, regardless of what area you want to look at, that primary care, emergent care, preventative care, everything in between, the emphasis on not what you're doing, but on why we're doing it. So Akamemok, I say to each of you, don't give up, keep going. This is a very important topic because each of us, every single day, every moment of our days is impacted by not only healthy living, but also well-being. Hi. Thank you.
Thank you, Lori. So much wisdom in those closing reflections. And Lori, if you wouldn't mind, I appreciate if you could put the words Wakatawin and Meokawatawin, if I got them right, in the chat box, so we can make sure to know the words and how they're said. Sean Crump, I'm going to turn to you next. Sean is the founder and CEO of Universal Access, an expert in accessibility and universal design, and also one of the members of the Possibility Panel. And I'll open it over to you, Sean.
Thanks, Chad. I guess it's kind of under the gun here. Let's see if I can keep this to 2 minutes. Yeah, I started a company about accessibility, and I think that that's a major facet in accessing healthcare, the physical barriers that prevent people living with disabilities being able to do, the preventative care aspect and all of these things. And as I was listening to everything and trying to take notes and make little points that I wanted to reflect on, I was missing other ones that I then wanted to take notes on. So I found myself in this kind of weird position and said, you know what, I'm going to scrap this and shoot from the hip. So here we go. One thing I found that everybody was kind of touching on was this notion of radical accessibility. And so that's not just providing, physical access to spaces or providing solutions that kind of accommodate on a one-off cuff, but really looking at it from what are all issues around accessibility and healthcare, whether it's a financial barrier, access to technology, individuals living out in rural communities and having that limited access to physical health. I think, looking at preventative as opposed to reactionary healthcare, and how do we start promoting that kind of aspect, and then the mental health portion, being more engaged in the community. A lot of us can now, empathize with the struggles of isolation. And although we've all been dealing with it for over a year, people living with disabilities have been dealing with it for generations, and the mental hurdles that come along with that. So I really liked the points made around bringing healthcare into the communities and making it kind of a community initiative and support throughout it. And then leveraging that private sector. I really liked the and statement, not an or, because that's where a lot of innovation comes. That's where a lot of, access to moving that needle forward can be done, because there's less, policy and, approval and all of those other things that need to occur in that public sector, through innovation, through technology, and through kind of private funding. Having some of that research, R&D, and kind of the ideal of what healthcare can be and how it can be administered to 100% of the population, as opposed to 70, 80% of those that can access it, on a regular basis, really tended to kind of resonate through this whole thing. And so, yeah, I think that radical accessibility notion is something that everyone was kind of circulating today, and one thing that I think I'll draw from when recalling this conversation and this event in its entirety. How did I do, Chad? 2 minutes? Pretty close,
Great.
Right? I wasn't
Very
too bad.
good, Sean. That was great.
Thank you.
That's good. Thank you very much, and thank you also to Ted and to Laurie for those closing reflections. And I agree, it's a challenging thing to do, to try to wrap up insights from 2 hours in 2 minutes. So well done to all three of you for your perspectives there. I just want to close by thanking you all for being here and for coming to the session tonight, and for participating and engaging in the way you did. I think of all the sessions we've had so far, this has probably been the one where the chat box was the most active. So thank you for that, and congratulations. We'll sift through all of that and the input on Slido and so on, and try to synthesize an output from this that will feed into to the rest of the Possibility Panel work going forward. And this last slide as we close here is just a continued invitation to stay connected to the Next 30 and to the ongoing events of the Possibility Panel. There are 2 upcoming sessions. There are more than this, but the 2 that are currently scheduled. One is next week, next Wednesday on the 24th, on the provincial budget, and we'll have special guests there, Trevor Toome from the University of Calgary. And then on March 5th, this one is actually, I believe, midday, is on talent, which is another topic that there's been a lot of discussion about in recent weeks on how do we attract and retain our talent in the province. So I hope you can join us for those. You'll get an email with an evaluation survey, and we really appreciate if you could fill that evaluation out, because it helps us to get a sense of what people are appreciating or not appreciating about the sessions and the improvements we can make. And of course, follow us on Twitter and just share your reflections on this session with your networks or your social media and so on, just to try to connect and invite more people into the dialogue as we continue with this work. So with that, I'll close the session and thank everyone again for being here. Take care.
Thanks all.